And don't forget, you do left and right sides. You do both sides on those exercises. Now, next exercise is to help strengthen the shoulder blade muscles. This one you can do laying on your tummy. I take a little roll under my forehead, so I'm going to place that there so I'm in a comfortable position so my nose doesn't get squished into the mat. Now, on this exercise, I'm simply going to roll my shoulder blade and hold it. I'm not forcing it way back. So it's important we're going to go in this sequence. Left, right, and both is equal to 1 repetition. So when I talk to you about repetitions here, 1 repetition again is left shoulder, then right shoulder, then both shoulders done together. I typically give these as a 5-second hold. What you're going to do, and I'll show you sitting and then I'll show you lying down. You're just going to, some people can't lay down, so this is a good way. And you can also lay on your back if it's too difficult to do laying on your stomach initially because of the strength. So the idea is you're just going to kind of roll your shoulder back and hold that position, not way back in that way retracted position, just a gentle retracted position. And I tend to go in a kind of half a circle, kind of up, back, and down a little, and hold that position. 5 seconds, and then relax. Same thing on the right, hold that position, and then both shoulders, hold that position. And just an example to see, this is way back retracted, and this is not what we're needing to do. We're just getting into that setting the shoulder blades, just firing the muscles around the shoulder blades, teaching them to work a little better. So it would look like this lying down. My arms are at my side. I'm going to take left shoulder, hold it in place for 5 seconds. And then relax. I'm just going to speed it up just for this. Right shoulder, 5 seconds. Relax. And then both shoulders. And 5 seconds, then relax. A progression to this exercise would be then to lift the arms off the table with it. So I can pull the shoulders back, lift up. 5. Pull back, lift up, hold for 5 seconds. Pull back and lift, hold for 5 seconds. That's a progression. There's another progression where we can just go straight into, with the little down the row, you can just go into pulling back and take weight and hold. Okay? So those are called I's, as in the letter I. I feel like it's Sesame Street, the letter I. We're going to do the letter I, the letter T, and the letter W's. Next is the letter T's. There's an exercise that think of T's and Y's and W's for these next few exercises. The next set would be just pulling shoulder blades, but just laying down. You can have one arm at a time over the edge or both arms and pulling backwards as if making a T and bringing your arms across back and forth. I'll show you with one side at a time, laying over on the left side of the table here. The other exercise is Y's, where we're going to be doing just like YMCA, not straight forward, not out like a T, in between to make a Y. And then we can just do Y's. Same idea, and I'll go through those. And then another one would be like W's or just straight, almost reverse flies, where we're bringing our arms back and just in a kind of a W position. Now, start with the T's. I can do one arm at a time, hanging over the edge of a bed. I can just bring my arm up and back. Now, if I'm extremely weak, I tend to teach people to fire muscles by isometrically holding for about 5 seconds, building up to 20 or 30 seconds. When you can isometrically hold those for 20 or 30 seconds, that's when we can start going dynamically through the movement without any weight. When you're able to do 30 times 3 without any weight and it's still not too exacerbated, it's still fairly comfortable, that's when you can progress to holding weights. Same is for all of these other sequence of progressions. I often do isometric and then build up, with the exception of the Y's, because people are usually so weak on those ones that I just go initially dynamically through, building up. Okay? Now, W's could be just coming back and up. If you have rotator, often you'll find rotator issues. People tend to give this down the road. So they're rotating with it. We're not going to get too involved with that one because this is more for neck and headache information. So those are all the ones laying on your stomach. We're going to go to some other positions for some other exercises next. So just like doing rows laying down, you can also do seated rows or bent over rows as well, which work for stability. Now, with neck issues, sometimes this is a little more difficult to do. It's a later on progression where we're going to do a bent over row. You can add those in as tolerated, but there's other exercises to do beforehand. So what I'm going to show you is the progression to that chin nod. One of the progressions is to start working this deep neck flexor with the short neck and long neck extensors in the back. So we do that laying on our stomach. The idea is, and I'll explain it because you kind of hear it muffled when I'm laying down. You're going to do the chin nod laying on your tummy. You're going to use your hands for support under your forehead or a roll. But you're going to do a chin nod, and then it's going to be almost lifting your head off your hands and holding that position. So it's almost, see, that's off, that's just barely coming up and holding. Same idea with progressions as we've talked about. So we're going to start with 5 seconds for now, and then you can progress the same way as we've been going on about. So in this position, I'm in a relaxed, comfortable position. I'm going to do my chin nod, or my deep neck flexor, tuck, and then almost lift the head off and hold that position. And then relax. So we're going to do 5 seconds. Eventually, I'm going to progress this one to being able to do it on the edge of a table, tuck in and lift. And then eventually off the table and just lifting in that knotted position. So there's general easy ways to progress those exercises. So it's important at this time to remind you that there's a couple of videos that I have online, or one video that is a self-mobilization. So there's 2 self-mobilization techniques. There's what is called a snag, and there's another one for headache self-mobilization technique. They're great for symptom management, so I would recommend going back and watching those as well. And I also want to talk about some stretches. So that's some exercises. Now I want to do stretches. And the question that I often address with stretching is, because there's so many ideas out there, people are being told one thing after another. The evidence, the literature time and time again says the length of a stretch, if we're stretching muscle to cause a muscle to relax, the time stretching has to total 1 minute. So you can do one minute stretch 3 times, or you can do a set of 2 30-second stretches 3 times, or 10 6-second stretches 3 times a day. So in other words, 1 minute total 3 times a day. The evidence shows that these stretches, and break them up however you want, they give you the same effect. When we're stretching muscle, it's an idea of changing that stretch threshold, that sensitivity of the muscle to being stretched. So you decrease that, so it allows it more free access, free movement. Stretching, when we're stretching to change really long-term adaptive shortening, that's a whole different situation. That's a really, really long, we call that passive prolonged stretching. And that's held for 20 to 30 minutes, 2 to 3 times a day. And it's a very gentle stretch. It's a mild stretch, otherwise people would just flare up. So if it's too aggressive, they flare up with a lot of pain. If we want to change connective tissue, in other words, not muscle, but adaptive connective tissue and scar tissue, that's a really mild, gentle stretch for a long period of time, a few times a day. Okay, so let's talk about some gentle muscle stretches for the neck. These help with headaches, they help with neck pain. They're really based on opening up, kind of relieving the stress of the neck. The 2 that I prefer, my favorite, is what I call nose to armpit. You'll see why. It's actually stretching the muscle at the back of the shoulder blade that runs up to the neck. So oftentimes you'll find that neck pain gets running all the way up the neck from the back of the shoulder blade. This addresses that muscle. You can take, if I'm going to stretch to the right, I'm going to take my left hand, either anchored on the back of a chair behind me, or sit on it, or hold it back just to anchor it, just to hold that shoulder from coming up. So I'm just going to anchor that down. I'm going to take that chin nod, turn to the right, drop my nose down, and just let my head drop and rest. 30 seconds times 2, or 10 seconds times 6, or one minute stretch, whatever's most comfortable for you. Just letting it stretch and relax. Do not need to pull. I often see people doing this stretch this way or this way. You don't need to pull that head down. Your head is 20 to 30 pounds. It's got enough weight and enough resistance to cause a gentle stretch on the muscle. That's all you need. Stretching should be comfortable, relaxing, and if it's causing pain, you're overstretching or you're stretching incorrectly or it's an inappropriate stretch for you. This is one of my favorite for neck ones. The other one that I will do sometimes, but I want people to be very careful on this one as well, is doing that tuck and just dropping the ear down to the shoulder. So there's nose to armpit and ear to shoulder. And again, it is not pulling. I don't need to pull that head down and over. I've got enough weight and resistance there to cause a gentle stretch, and that's all I want. Those are the two directly for the neck that I like the most. The one that I will see that I stop people that I think is contraindicated, that is not a good stretch because it's given for all the wrong reasons, and it does put stress on the arteries of the neck, is the one where you see people and they're often told they have tight scalenes or scaleni. Depending on where you're from, you could call them scalene muscles or scaleni. The muscles in the front of the neck, and they're often given this stretch where they tilt sideways and look to the opposite side of the roof. This puts traction on the vertebral artery. I don't agree with this stretch. I think it's not a safe stretch. In fact, that stretch has been implicated in causing strokes. So I would highly recommend not using it. For the other point of that stretch is that you're often told that your scalenes are elongated because you have a head forward posture. And I defy any physio or any chiro or any practitioner to actually get into an anatomy lab and measure those two different positions. A brilliant therapist named Earl Petman defied us all as young therapists to actually measure that. This head forward posture means that those muscles aren't short and tight. They're tight because they're stretched. They're in a stretched, elongated position, so they feel taut. There's a difference. They don't need to be stretched. They're already in a stretched posture. So the two that I really like are the ear to shoulder, nose to armpit. The one I do not like is that one, the scalene stretch. The last set of stretches is more for the chest muscles. With that head forward posture and that slouch positioning that we get into day in, day out, working at desks, doing things forward like this, we tend to get tight up here as well. Anytime we exercise, we tend to do this and ignore our back, so this gets tighter and tighter. So we really need to focus on stretching. If we're going to correct posture, we want to open this up. A really easy and simple stretch to do there is you can take a longer towel than this, you roll it up lengthwise, so you would roll it the lengthwise, or a blanket works very well. And I've just got this one to illustrate, but you would get the idea with a long, big, full-size towel or a blanket. Lay it down, you lay over the towel. Let that sit at the spine. Also have the support at your neck. This is too short for my head, so I'm just gonna lay here. Now, I'm just gonna do a T. This is where I do a T. I let both arms drop out to the side. I'm raised up a little bit. I can get a gentle stretch. If I can't get a towel behind me, I can do one arm at a time by just stretching outwards over the edge of the bed. I can feel this nice gentle stretch. I could sit here gently for 20 minutes. If I had contractures, it would be a nice gentle stretch to stretch out the contracture. If I'm just opening, stretching up, this is just a nice way I can do a minute at a time and relax. Focus on breathing from the stomach while I'm in this position and allowing myself just to completely relax. That's one of my favorite chest stretches because it's gentle and it's easy to do. The other stretch that people will often do is that corner stretch. I think that's a great stretch. I think I talk about it in one of my other YouTube videos. However, I'll just explain it here. I don't have a corner at this moment, but it would be where I would take my arms into a corner of a wall. At the corners here, I'm going to step forward and just allow myself to stretch out and allow my chest to stretch. I can do one arm at a time with a wall here and stepping through a doorway and stretching, keeping my body neutral and just getting a gentle stretch. What I often see is people putting their arm forward like this on the door jamb and pushing. That's not getting a stretch. Your arm needs to be back here and getting a nice, gentle, comfortable stretch. Nice and easy. I can incorporate biceps with a straighter arm as well. Nice and comfortable and just allowing that opening up sensation without pain. If it's painful, change your arm position to a more comfortable position, up or down. Usually down is less painful, and eventually over time get it up so the arm is almost at 90 degrees, but stretching the chest. Okay, well that should give you some exercises and activities to manage some of your symptoms, to help you cope and build some strength and posture training. Remember that neck pain and headaches don't clear up today, tomorrow. It takes time. Build up the strength, and hopefully the frequency should be less as far as the pain goes, and intensity over time. And most importantly, you should be able to regain improved function and normalized activities. Thanks.